Hello, Dr. Jonathan Ferglis from the Cebu Orthopaedic Institute, and today we are going to discuss about shoulder pain. Sakit sa abaga, kanang sakit dire, sometimes dire, and sometimes it can radiate down sa arm. So join me, and I hope you learned something from this. And if you do, you can do certain stretches or exercises, which I will be showing with you today. So patient with different types of shoulder pain may be unable to lift. Dili nila masakay lang abaga kutubra dire. Sometimes maglisod og tangtang sa bra or maglisod og kabot sa likod. Unable to reach the back or the bra. Pain at night, especially kanang dili makatulog or sakit inigmata na diri sa abaga. Sometimes this type of pain can radiate to the neck, sometimes it can radiate to the arm. We need to be careful kay there is such a thing as cervical radiculopathy. So pwede na siya nagikan sa cervical spine or pwede sad gid na siya nagikan sa abaga human it is a referred pain to the neck and to the arm. That can happen as well. If dili maisa, that can be already an impingement syndrome. Pwede sad na kanang gitawag sad og frozen shoulder. It's really important na ma-examine nato ang pasyente in these cases kay especially kung dugay na ang pain, wala, di pahilot na ninyo, you've tried medicines, you've tried kanang manipulation or massages and it's not improving, muscle relaxants or things that you can do, nahaplasan na. For improvement, please come see us and we will need to do an examination for you or to get to know what you need. A lot of things di mo na makita sa x-ray. Sometimes we may even need other tests aside from x-ray like an MRI scan. So good morning everyone. Again, Dr. Jonathan Flordelis here. Today we're going to talk about shoulder pain. So kanang sakit sa abaga, dili ninyo maisa, inyong kamot, stuff like that. Pain may be radiating sa neck, maybe the back of the neck, the upper back, that can be part of shoulder pain. So again, if you have these types of pain, it may be a good idea to see your orthopedic surgeon. We are the Cebu Orthopaedic Institute and we're here to serve you. We are open for online and we are open for online consultation. We are also open for face-to-face consultations as well at 4th floor, Robinson Cyber Gate, Cebu City. So let's start. So a little bit about myself. Did a little training in Australia. Now, pain in the shoulders can come from pain from working at the desk for a very long period of time, especially when you have kind of air conditioners behind you, maigo ka sa aircon sa imong liog or sa imong abaga. That can result in neck pain, shoulder pain, and even back pain. Especially if you've been sitting for long periods of time, maybe from 9 a.m. to 4 p.m. in the office, that can result in different types of muscular pain or musculoskeletal pain. Now, this type of pain is called Myofascial pain syndrome or MPS. It can be caused by stress or injury to the muscles or even cold exposure. So, ang highlight nato dire, this is the part where you actually have pain in that area, very common. And it can have an effect on the back, the neck, and the shoulder. So, MPS can be from pain or pressure in different parts of the muscle called taut bands, kanang inflamed muscles because of the stress of too much cold, an actual injury, or even moving too quickly without stretching that can cause muscle pains as well. And myofascial pain is usually found in very, very stressed individuals working from 9 to 5 or even more than 8 hours a day in their offices with cold air conditionings behind their backs. Now, the treatment is we have NSAIDs or pain relievers, muscle relaxants, stretching, and rehab initially. Of course, there are some other techniques that we can do, such as steroid injections for really, really severe pain. Kanang injection ng gidug tambal, a combination of a anesthetic with a muscle relaxant or steroid can also be done. There are new machines for this as well, which you can find with certain therapy or rehab centers. And this is calcific tendinitis. You may find this in X-ray findings na naay gamay na bukog na nitubo on the bone, and this is actually a shoulder X-ray, and you see a bit of calcium deposits or calcific tendinitis in this X-ray. So that small dot is not supposed to be there. That's a calcific deposit, and if you have this on your X-ray, you may have calcific tendinitis. Now, this is a video of calcific tendinitis. It's actually showing that it happens on top of the bone and on the muscle, which makes it really painful. So, sakit kayo ni iisa. Of course, pwede sad na sakit iisa because of other causes. Like I mentioned, pwede na because of cervical injury, pwede sad na because you have actually a injury to the muscle aside from calcific tendinitis. Now, the treatment for calcific tendinitis, you can have rehab again, referring it to our friendly physiotherapists and rehab doctors, pain relievers, muscle relaxants, and you can have debridement, which means limpyuhon tong calcium deposits in the muscle para di na siya mudaghan, di na siya musakit. So relieving the pain of the patient. And these are some pictures that you can find intra-op, meaning during surgery. That's a calcium deposit, and when you open that up, daghan kay more toothpaste-like material coming out. Okay, so frozen shoulder or adhesive capsulitis. We always hear na, uy, di na malihok ang abaga, it's a frozen shoulder. So it is a general term, and it does not mean a specific disease. So pwede ni ang cause sa imong frozen shoulder can be many things. It can be your calcific tendinitis, it can be an injury to the shoulder that's causing the pain, and then tungod kay walay lihok-lihok, or because you have not been moving for a very long time, then the joint freezes or becomes adhesive capsulitis. So very common in 40 to 60 years old siya, and dili na matuyo kaayo, so there's loss of rotation. And what you see here is a picture of a frozen shoulder that the capsule has shrunk down, so ni shrink imong capsule. Now, these are certain treatments na pwede buhaton. We can have the rehab. We have a rehab center here at the Cebu Orthopaedic Institute. You do not need to go to a rehab center all the time, because here in the third floor of Robinson Cybergate, we have our rehab center. A hydrodilatation is an invasive procedure na some people do. They inject saline in the joint. Injection ng saline para maburot and loosen up the joint. Manipulation under anesthesia is another way. This requires a patient to be under anesthesia so that he will feel no pain while we move the joint slowly and gently. And lastly, arthroscopic surgery as well, kanang gagmay na mga cameras na isuod sa shoulder. So that's arthroscopic surgery, and we can offer that to you as well. So those are the many treatments for frozen shoulder nang kahilihog ang baga. And this also is not just frozen, it is also painful. So sakit kay ni siya, di malihog, and we don't know what is causing it. So this is a normal shoulder on the left compared to a frozen shoulder on the right. Now what you see is an inflamed joint, kanang pula kayo, or suko kayo, so angry, red, inflamed joint. That's what you see in frozen shoulder. And it usually, like I mentioned, occurs in about 40 to 60 years old. And it can be caused by many things. It is a sort of wastebasket diagnosis. It's not actually the cause of the injury. Now, what you see here is a swimmer, and sometimes there are certain strokes which can predispose you to shoulder pain. There are also certain anatomic differences. Kanang mga tao na hait o bukog sa abaga, they have different shapes and forms of bones. There are certain forms like type 3 acromion, mga hait na bukog na sakit ang imong abaga when you do certain movements, and that can occur with time as well kung naakay arthritis happening in the joint. So like I said, there are many causes for frozen shoulder and shoulder pain. It can be because of an injury, it can be because of your anatomy, or you have been made like that gyud imong abaga. It can also be because of a arthritis that is forming that can cause shoulder pain. The type of activities can also predispose you to shoulder pain if you have on top of that nanakay arthritis or nanakay impingement, musamot na sila with certain activities. So impingement is when you have a hook-shaped bone like this one. The hook-shaped bone here is the acromion, and sometimes some people have this shape of bone, and that predisposes them. So mas dali ra sila mosakit ilang abaga when they do certain exercises or activities like tennis, overhead movement, and swimming. That can predispose you to impingement or kanang maipit ang ugat sa abaga. So in medical terms, ugat can mean a tendon, a nerve, artery, or vein. But in this case, we mentioned ugat as a tendon. So impingement can be an ugat na maipit is your rotator cuff tendons. And that is what you see here. When you lift the shoulder, kung isa nimo, mosakit siya. And we treat this as well with NSAIDs, relaxants, rehab, and lastly surgery kung sakit gid kaayo and everything else fails. We may do arthroscopic surgery for this type of patient. Now, acromioplasty is also a type of surgery for those who have an anatomic hook-shaped acromion, like this one here. We can take some bone off para di na siya musangit, and that can happen in certain individuals. Now, trauma to the shoulder, especially in athletes, you can have falls, and kung mahagbong ka, when madakdak ang imong bagay, you can have a injury like a AC separation, acromioclavicular separation, and it's very painful. You are treated with a sling or rehab, and sometimes even surgery kung grabe gid kaayo. And reconstruction using a sling is one of the procedures that we can do. A rotator cuff can also be torn, and in this case we have a famous doctor na rotator cuff tear and repaired ang tear with a suture anchor. Now for the clavicle fractures, not all clavicle fractures need surgery, but if it's skin tenting manang mo tusok na sa panit, that can be an indication for surgery. If the patient is very active and wants to go back to work right away, you can also have a surgery. But 80% of the cases can heal even without surgery. And especially the children, they heal very quickly without surgery. You just need to know that it may not be exactly like the other side. So naagin na healing that occurs, and the bone, once it heals, kanang maayo ng buko, murag maundan siya, it becomes thicker and mas baga siya gamay. So nagi difference, a little bit different from the other side. So you can treat clavicle fractures using these straps or slings, like this patient here, and you can treat it with surgery. There are many types of surgery for the clavicle fractures. And lastly, we have shoulder dislocations, kanang especially people who have lax joints or who are double jointed, kanang humukay lawas. They can be predisposed to dislocations because of their ligamentous laxity. Kanang ilang joints, ilang mga ligaments are very, very flexible. That can happen, and really, kanang shoulder dislocation, it needs to be treated with care and rehab. Dili na ibalik lang ang bukog and then maayo na. You really need to undergo physical therapy and rehab to prevent the most common thing, which is redislocation. That's the most common complication. And if it keeps on happening, there are structures inside na magisi, and that will need surgery in the future. So you don't want to have surgery. If you have a dislocation, please come see us. We will treat you with care. You may have a tear in the glenoid labrum, which is what we call a Bankert lesion, and we can also repair different things in the shoulder as well. So I hope this was valuable to you. I hope you learned something. And if you do have shoulder pain, please don't treat it by yourself. Come and see us at the Cebu Orthopaedic Institute, and we will do our best to care for you and your body. Contact us at 239-2211 or at Facebook. You can also have an online consultation with one of our specialists at SiriusMD.com. So I hope this was valuable. I'll see you next time. Thank you very much.